Hey, kids cook real food. Katie Kimball here with this episode of the Healthy Parenting Connector. I'm so honored to have Dr. Emily Gutierrez with us here today. And I just know this is going to be super helpful because a lot of members in our community have children on the autism spectrum. We find in our cooking class that the repetition and the videos work really well for kids on the spectrum, which was an amazing surprise to me. But I also know that just we have a lot of people in our community, and unfortunately, statistically, I know that it's growing. Like the number of children with autism is growing and growing. So more and more parents need the information that Dr. Gutierrez is going to bring to this interview today. Just to kind of let you know who she is. She's the author of a brand new book, The Parent's Roadmap to Autism: A Functional Approach, which is an amazing resource for parents, especially those who may not be able to find local access or afford access to an individualized approach to medicine and healing for their kids on the autism spectrum. Dr. Emily runs Neuronutrition Associates in Austin, Texas, one of the first pediatric functional medicine clinics in the US. So thank you for bringing functional medicine to the pediatric world. That's so important. But she started out as a conventional medicine nurse with a doctorate from Johns Hopkins. So we'll kind of hear a little bit about her journey today and a message of hope and healing for parents of kids on the spectrum. So again, thank you so much, Dr. Gutierrez, for being here today.
Well, thank you for having me. It's an honor.
Good deal. I mean, this is going to be amazing. Your background has a really interesting blend. I thought of conventional and functional medicine, and I see that more and more these days as practitioners are finding themselves disenchanted with the world of traditional medicine and finding something better, something that feels more like it's clicking with them in integrative and functional medicine. So what happened for you to cause that shift, and how does that impact like how you practice today?
Well, when I first started practice in primary care, I worked in a busy practice that, seeing 25 to 30 patients a day. And, I'm in Austin, Texas, where our motto is to keep it weird. So we have a lot of people that just have different ideas about how we should be handling their health. It doesn't really kind of fit into this very specific allopathic model. So there were those moms that were the oil rubbing, tree hugging, didn't want to do anything conventional, but they also wanted me to provide medical care for their children. So when I got to Hopkins, part of the doctoral experience was really trying to choose your problem in practice. And my problem is I could not connect with these parents. And, I wanted to provide healthcare no matter what it was called. I just wanted to provide the best healthcare, what was the best outcome for the child. So it sent me on this path with, how can we do this that's science-based, safe, scientific, and also meets the parent where they're at. And so I really started to dive into integrative medicine and understanding that, vitamin C not only treats scurvy, but actually it can prevent the common cold, and, different applications for nutraceuticals, which we're not taught about in school. And then, if anybody really understands integrative medicine, it will lead you to functional medicine, because that's about trying to understand the root cause of actually the chronic condition that you're dealing with. So it was just kind of a journey through understanding, trying to connect with my parents, really.
That's beautiful. That's so great. And then it ended up being a good fit for you after all.
Yeah, definitely. Because, personally, if I'm going to be a little bit vulnerable here, I suffered from, feeling a little anxious and depressed kind of throughout my teenage years and early adulthood. And I was always told that, well, let's try this medication, or, maybe some more counseling. And with all the medication and counseling, I still never quite felt 100%. And it wasn't really until I started to understand the role of folate and, B12 absorption and the gut and, hormones, that I was able to really heal myself and be medication free, which I've been for a very long time. And that sealed the deal for me. Not only can I connect with my patients, this has actually transformed my own life. And now I'm passionate about what we do because I know how transformative it can be, no matter if you're applying it to depression or anxiety or autism or chronic irritable bowels or eczema, you name it. So, the functional medicine really does work when you know how to kind of systematically look at someone and attack it from multiple different levels.
Wow, what a powerful experience. And thank you for being vulnerable like that. Because again, I know that so many kids and teens are struggling with depression and anxiety. To me, it's the graph that's most alarmingly trending upward among the young generation. So it's good to hear that, you're able to heal yourself. What a beautiful experience to really solidify that, yes, like this is what you want to practice and this is how you can help people. Now, autism has only even had a name since 1943. So what's changed since then about how autism is defined and how it's diagnosed?
Well, this is kind of a debate on, is it just the definition of autism has gotten broader, so more people are on the spectrum? And, back in the 1940s, it was a product of a bad mother. That's what people thought, is you just had a mother that wasn't as, cuddly and loving as needed. And then, to today, it's more of a spectrum diagnosis, meaning that anywhere from, even being very ADHD sometimes can be put on the spectrum. So we've expanded the criteria for what fits in the spectrum disorder. So more kids are included in that. However, my firm belief is the way that our world is and the amount of toxicity that our children experience from prenatal to, preconception to, up until time of diagnosis, that there's a lot of inflammatory stress that is occult. So meaning that it's underneath the surface that might not be obvious to the pediatrician, that, you don't have fever and an ear infection or a big rash, so you're fine. Which really, if we take a deeper dive and really look into the physiology, you'll see that there are a lot of imbalances and a lot of burdens that need to be corrected.
Definitely. I know it's like the easy way out. A lot of people say, oh, well, we're just diagnosing it more. We're just expanding things. Like, it's not really alarming, but I'm glad to hear. I mean, I'm not glad to hear, but I'm not glad to hear that it should be alarming, but I'm glad to hear you acknowledge, like, this is a real issue. And the good news is there is a root cause, right? So in your book, this was so interesting to me because you talked about like philosophical differences between conventional treatment being very tied to a large sample size and like dedicated research. And then your approach is a little more N equals one. But why do you think that's more effective? Because most people would say, oh, like N equals one, that's anecdotal.
Yeah, well, and being a Johns Hopkins graduate, we learned about randomized placebo-controlled trials and, rating the evidence for what was the highest level of echelon, to what's kind of junk research out there. And everyone, really takes, firm belief in that randomized trial that's placebo-controlled. But the truth is there's this shift to, okay, can we really do an RCT trial in these big cohort studies and account for all of the confounding variables, meaning that your environment's different, your genetics are different, your nutrition is different, your environmental social impact is different. There's too many variables, so why aren't we looking at the individual? Because everybody has a unique story. And that's why even practitioners in functional medicine sometimes ask me, what are your protocols for this? And what are your protocols for that? And I don't have protocols. I don't have protocols because everyone is different. Everybody's needs are different. They're different from their nutrition to their, their psychological, social, emotional impact. There are big themes, but everybody is individualized as well. And one thing I often see in practice that I think is also important to mention is that I think that some parents are getting a flippant diagnosis of autism as well. So, the kiddo that comes in and isn't talking by 18 months, but has had chronic ear infections and nobody's checked his hearing. I mean, let's start from, the very beginning, which is let's check the hearing first and not alarm the parents. When my child was 9 months old, we went to the pediatrician, and he's a teenager now, but we went to the pediatrician and he wasn't very cuddly. Didn't really like to cuddle up to me, really liked to be, held on that baby Bjorn looking out, really all over the place, very, very verbal at that point, speaking in full sentences. And the pediatrician said, well, let's just keep an eye on him because he probably could be autistic. And I remember that day I went to get a second opinion. That very day, it was alarming because, I'm not prepared for that. And, this is, he's been normally developing so far. And it just, it created an alarm bell that wasn't there. But also on the other hand is, if he was going to have the diagnosis of autism, I need more hand holding than that. You can't just say, oh, let's watch it and send me out the door. I need to, let's have some more things that I can grasp onto. And I see that with parents is they'll get this diagnosis, or they have a rare genetic condition that looks like autism and has autistic features, but it's really a chromosomal thing, or it's a very clearly genetic thing. So people don't really do the work to find out what the genetic underpinning is to the autistic type symptoms. And that's an important variable, because if it's a chromosomal abnormality or a big, like I have a child that has a major cluster of genes missing, only so much functional medicine will help him. We can improve him to where he is, but he has a rate limiting variable to how well he'll get because he's actually missing DNA. So there's that part too that I wish that people were a little bit more careful with.
What a blessing for parents in your practice to have such an expert on board. And I don't actually know this part of your story, but that you telling that story about your child at 9 months made me wonder, did that play a role in you like focusing in on autism in particular? Like what drew you to really be an expert in autism?
Well, when we got out into the field and we decided to start our own practice, which came, I never really intended on starting my own practice. It just kind of was one of those things that we worked with a neurology team for a little bit of time after I got my doctorate. And, we were the kids with the most chronic issues in pediatrics, or a lot of neuropsychiatric things. So that's why our practice is Neuronutrition Associates, because there's this huge need for kids that, have OCD and anxiety and depression, and, that have all these neurodevelopmental delays as well. And so autism, just became a huge client of ours, families with it. And it's something that we have seen some pretty miraculous things happen when applying functional medicine. We've seen some pretty, kids that weren't talking start to talk, kids lose their diagnosis. And we've just seen some pretty powerful changes. And so when you see that, it makes you more passionate about getting the word out about, hey, take functional medicine, apply it to autism, and really you can see some pretty powerful things.
That's amazing. That's great. And, I'm curious, that Neuronutrition Associates name, I don't think neuronutrition is a phrase or word that many of us have heard very often. Is there like a definition for that? What is neuronutrition?
The neurologist that I was working with previously, Dr. Dilip Karnik, he said neuronutrition, and I think he actually made up the word. So now we have a definition in our book of what it is, but it's basically, applying nutrition to cognitive sciences, because, so many people think of serotonin and dopamine, our neurotransmitters, that need, a little bit of Prozac to make them better, or a little bit of, medication to make them more observable, when actually, if you understand the biochemistry of neurotransmitters, it has a lot to do with nutritional cofactors and the gut microbiome and, there's such a complexity to it that is not all about medication. So, there's a science to how kids pay attention. They need all of these things, to, like zinc, in order to make dopamine. They need, their genes need to be efficient in breaking down that dopamine and those catecholamines so that they can attend and have that, organization, that prefrontal executive functioning come on board. And it's not a medication deficiency. Things like that have an absolute root cause to them. And when you can change the diet, improve the nutritional status, and get those genes working to the best of their ability, but you lose your diagnosis in a large majority of the time.
Wow, what a fabulous thing to even think about for parents of a child on the spectrum. If anything, you want to lose anything, it's your diagnosis. So I
Yeah.
love that you look at root cause and just that idea of like, this isn't a Prozac deficiency. This isn't a deficiency of a medication. This is probably a deficiency of something we need
Mm-hmm.
nutritionally in our brains. That's so great.
Mm-hmm. And it's kind of a pet peeve of mine when, those families go into the neurologist, and not calling out one neurologist or the other, and they say, well, what about gluten-free, casein-free, soy-free? We've heard that could be really helpful for kids on the spectrum. And the neurologist will say, very typically, changing your diet isn't going to make any difference.
Oh, that's so
So
frustrating to hear.
it is so frustrating. And, those kids are coming in, drinking Dr. Pepper out of a bottle, eating their Takis. That very, very well happens. And just that somebody in an authoritative position can say, yes, eating more micronutrients and taking out the sugar and the junk and the actually, your gut is connected to your brain. And if we can decrease overall inflammatory stress within our body, our brain functions better. Even that message at that point in their care would just be impactful for so many people. But often it's, nutrition doesn't do anything, And I always tell my patients, well, what happens if you just don't eat? Over time, don't you die? Isn't food doing something? Right?
Yeah, it's so
So,
frustrating. Bothers me so much when doctors like speak on things outside their field, right? Like if I'm a neurologist and someone asks me about nutrition, perhaps I should say, I don't know. That's not my field. That'd be
yeah.
so much better. Obviously, best case, they come to you or they read your book and hear the truth. But it's
Mhm.
so much better. And maybe doctors are afraid to say they don't know, but what a bummer. So Dr. Gutierrez,
Yeah. And
go ahead.
that's a red flag, because you want someone to say, I don't know, but let's figure out it together, or let me get somebody that does. Because as soon as you're under somebody's care that says, I know it all and I have all the answers, you better run. You got to have that ability to be vulnerable, but also to not know everything, because, I think it was, yeah, I think it was Einstein that said something about, whoever knows everything really knows nothing,
Mhm.
So anyway, I didn't mean to interrupt, but
No, that's okay. That's okay. I just love hearing stories so much. Do you have any anonymous kind of stories of change? Maybe someone who lost their diagnosis? Like, what does that look like in reality in a family?
mm-hmm. Well, yeah. So we've, I think one of the better success stories that we've had is, we had a little girl come to us, and she was 18 months old and non-talking, lots of autistic behaviors, seen the neurologist, got all the testing, had a brain image, had, a lot of the big rule outs that I believe are needed to do for autism. But she's extremely irritable, not sleeping through the night, lots of stimming. And kids that are on the spectrum will stim to self-soothe. So they'll headbang, or they'll rock, or their hand flap, or they'll, do these repetitive stereotypical behaviors over and over again to soothe themselves. We ended up looking at her from a functional lens, and, she was only eating a couple of foods. She had been on chronic antibiotics. Not only had she been on them for ear infections, but her mother had to have IV antibiotics when she was born. She was born via C-section. So we jumped in and we, looked at her nutritional status. We looked at her gut. We did some organic acids, and we found that she was extremely overgrown in something called Clostridia. Clostridia promotes an enzyme called HPHPA, which actually inhibits dopamine. Dopamine inhibition can have you have deficiencies in other catecholamines. So it really kind of changes your brain chemistry. So we did a big workup on her and working through the clostridial markers. We gave her some medications. We put her on some supplements. We changed her diet. And, by the time she was 2, she had several words. And last time that I followed up with her, she's eating a way bigger variety of foods. She doesn't stim anymore. And she is, going to be in a 3-year-old classroom that's inclusive, no special, ABA therapist with her or anything like that. So she's really, I feel confident that she's not going to have the diagnosis at all, going forward. So it was a great success story. There are parents that, not everyone will lose their diagnosis of autism when they apply functional medicine. I think that's a really important thing to let parents know. But you will see improvements. Every child that we've seen have seen improvements. But some are limited. The older you are, the harder it is to move the needle. That's why early intervention is very, very important. And then there are some people that have rate limiting factors that are genetic that you can do as much as you can do, but there's still going to be a limitation to development just based on their DNA. So there are those, but most everyone sees a large degree of improvement. And for kids on the spectrum, for parents, some of them are super aggressive. And they just want like we improve the aggression, or the kid's never been potty trained because they have chronic constipation and they're 5, or they don't sleep well. So there's all of these things, that can be improved. And I bet you tell your families this all the time is, nutritional therapies in particular, if you're going to use nutritional therapies primarily, which I believe that's the foundation of everybody's health, it's not like an Advil. You don't take it and 30 minutes later, you're like, wow, my autism is gone. I'm feeling better. It's consistency, and it's over time, and it's building that foundation that you're going to see growth from. So you have to be patient and you have to persevere.
That's good to hear. It's a good reminder that nutrition is the foundation. But yeah, I do tell people, like, nothing's magic pixie dust when it comes to anything in parenting, even motivating kids or, cooking. Usually we say that getting kids involved with food helps them to be open to a wider variety of foods and eat better. But it's not magic pixie dust. It's just one, piece to what you're building here. But oh my goodness, for parents of children on the autism spectrum, to hear those messages of hope that some of those things that make family life so difficult can actually get better. That's awesome. That's so great.
Yes. And not medication free, which, can be feasible without medications. So I think that's important.
Yeah, that's huge. Well, congratulations on the new book. It's so exciting, I'm sure, to see it. You have it with you, right? You got to hold it up.
I do. Have it here.
It's so good. So what's kind of the goal of the book? Like, how can parents and loved ones of a child on the spectrum, expect to utilize information in your book?
So the goal of writing the book was it was twofold. One, it is to get the message out on how applying functional medicine really can improve the lives of children on the spectrum and families with children on the spectrum. And then there's one thing that I don't like about functional medicine, and there's poor access to care, and it can be really expensive for families. And so, at this point in our history, I think functional medicine is accessible to those that are more affluent. And that is heartbreaking to me. Some of my favorite jobs in my career, in my early days, were working with, the Medicaid population and people that didn't have, enough money to have gas to come to the clinic, And I think about those families and how, they're affected by autism too, but they don't have access to care. In fact, our book is being translated in Spanish right now by one of our families, because they're just like, how can we get this message out to Spanish speaking families as well? But the book was really about, trying to disseminate knowledge. How do you think in functional medicine terms? What are the big rule outs that you need with autism? And what are the big rule ins? How is the immune system affecting the child? How's your gut affecting the child? How's your nutritional deficiencies? How is toxicity burdening the child? So it gives a good overview of the core areas of burden typically seen in a child on the spectrum. And then, parents can read that and they can apply different principles just by reading the book alone. And then if they want to take it a step further, we've created learning modules on our website where they can go through, like say if their child, like chronic diarrhea has been a big deal for them. Well, you can choose the gut module and kind of go through. And I did teaching with, here's different supplements you could try. Here's different labs if you wanted to do a lab and see. So we can have access to some people that cannot get their, that don't have a functional medicine provider in their area or want to do things on their own. So they can kind of do this journey with their child on their own. And we wanted to facilitate that experience, learning tools and tools with, access to really good supplements and different labs, but knowing the education on how to apply it. Because often you'll see in these biomedical groups online, these Facebook groups, it's like, oh, well, have you tried this supplement, or I've tried pycnogenol and this is working, or who's doing inulin now, that's working. And it's like, well, yeah, so the reason that it doesn't work for everyone is because maybe that kid that needed inulin really needed a lot of prebiotic fiber to grow their diversity and their microbiome the most. And once those microbes flourished, then we were seeing greater, cognitive effects. So, but somebody that has a great diverse microbiome, but then has, mercury toxicity, you're not going to see such a great improvement from inulin. So, there's a scientific methodology to doing it, and education is important, so hopefully the book gives parents that. And we wrote it so it's not in big medical terms, that hopefully it's understandable for anybody, that has, up to a 6th grade education. So
yeah, I can definitely confirm that, because I read the first chapter and then I skim read the rest. But it's very accessible, and what a gift to parents to really empower them. I feel like what you're doing is giving parents the knowledge of how to be their child's own detective.
yes.
Right. So it's not the Pinterest version. It's not try this, try that, maybe this will work. It's how do you figure out what's at the bottom and then what to stack up that might actually work. It's such a gift for parents. Now you just mentioned the areas of burden, and this is a phrase I haven't really heard before. I mean, I kind of have, like body burden, but what are the areas of body burden that would impact a child with autism, or maybe even other chronic diseases included in that as well?
Oh, yeah. So, there is a great neurologist that's MD PhD from Harvard, and her name's Martha Abair, and she really coined the term the body burden. So she wrote a book called The Autism Revolution that I read, that I loved the way that she is trying to frame, why do some kids, where are we on the spectrum of health? Because say 0 is perfect, which nobody is there, and 10 is the tipping point for disease. And so if we have, Clostridia overgrowth, which is like a bacteria that's out of balance in your body, or we have fungal overgrowth, we're tipping towards 10. And then if we have, a metal toxicity, and then if we can't sleep, you're going to tip over to where you're creating these symptoms of disease. And often on autism, you'll hear everything was going fine, and then, there was a trigger. And, some kids are triggered. They can be triggered by an illness event that can happen. I know this is very controversial to say, but it's my truth that I've seen in my work and in our clinic is some kids are triggered by, I went to the 15-month-old visit and I got 7 vaccines and then they had a regression. I'm not saying that vaccines are bad, but I am saying that some kids on the spectrum have had reactions to vaccines.
And if they already have built up some toxicity on their body burden, you're saying that it could have been any number of things, right? And it just happened that was their tipping point that overflowed the bucket of body burden.
Yes. So my work in all of my patients, no matter if it's autism or irritable bowels or, or eczema, it's where is the burden and how can I tip you back towards zero so we can increase resilience, like my kiddos that, have chronic allergies, right? Right now in Austin, we're going through cedar and we're about to be into oak. And, my asthmatics that really react to this, well, their burden's going to be higher because I can't control what's happening with the trees outside. But if I can really, support their methylation, if I can really support, how healthy and robust they are going into it, they might not have asthma attacks all throughout the season, right? So it's how do we all in our life create, room for exposures so we don't live in this, world of just feeling panicked all the time that we're going to, get cancer or get ill or not be able to, be relaxed and go on a weekend with our girlfriends and maybe have that piece of pie that you normally wouldn't have during the week, you got to live life too. And if you have that resilience, then you have more flexibility with chronic disease.
Mm-hmm. And it's very cool. And I'll make sure that I write this anywhere we share this video, that this book is not just for parents of kids on the autism spectrum, because really any parent, any human being should learn how to both build their capacity and reduce, the problematic toxic body burdens that are like weighing down on us all. Fair to say?
Oh, absolutely. That's what's interesting about this different kind of shift of functional medicine is it's changing the paradigm. It's this, where are our systems, talking about our gut and our immune system and our energy system and, the world around us and our toxicity and our social and emotional stress. How is all that interplaying into our body, right? Instead of the ENT treating an ear infection and the pulmonologist treating a lung infection, all of our systems are connected, both inside and outside of our environment. And when you apply that systems-based connected approach, I don't care what you call the disease really. Like when we trained our admin up front to take calls about, who can come into the clinic for a new patient, she at first she was running back, well, they have Crohn's or they have fibromyalgia or they have this. And it's like, I don't care what they have. If you can apply functional medicine to any chronic condition, and you'll see improvements. So, an acute condition, if you have strep throat, I'm going to give you amoxicillin or ceftonir. I'm going to prescribe you an antibiotic. Thank goodness there's emergency rooms and there's medications for acute disease. And if you're having an asthma attack, you need a steroid. I'm 100% behind that too. But when it comes to kind of this chronicity, right? And they say that like 1 out of 2 Americans have a chronic disease of one sort or the other. We need to think differently about how to treat it. It's not just an immunomodulatory medication, meaning a steroid or an antibiotic. It's way beyond that.
Good. So nutrition, of course, is something that's near and dear to my heart. Here at Kids Cook Real Food, we're all about helping kids eat healthier. And we work with a lot of families with kids on the spectrum who are those extremely selective eaters, like 5 to 20 foods that they'll allow past your lips. And we find in many cases that the research is correct. When kids work with food, they're more likely to eat it. But like I said, not magic pixie dust. Do you have any other quick tips for families of those eaters to kind of help expand their palates?
Yeah. So, we call it I have a different style with my partner has a different style, and I have a different style, and I think you can apply this to any picky kid, whether they're on the spectrum or not. When I went into my first big functional medicine conference, you spend kind of a week on campus really learning, and the basis of almost everything is it all has a nutritional underpinning, right? So I came home and there were things in my cupboard that I didn't want there anymore. And I threw out everything. I was like, I'm done with this inflammatory mess. I'm not gonna buy another, Diet Coke. I'm not gonna buy another, low fat chip. I'm done. We're done. All the dyes, all the refined grains, everything gone. And it hit resistance within my house. Mom's gone crazy. Mom's a nut now. What is she doing? But now, like, I made a beautiful stew last night, and everybody's like, oh my gosh, that, full of vegetables and bone broth and grass-fed beef, and everybody loved it. And that's what we had for our Super Bowl meal, and everybody eats very well and very well rounded. And they just know that this is the paradigm shift for how we eat. However, that took me saying, I'm changing, and you're going to have to catch up to where I am. And for some families, if their kids don't eat, they feel like I failed, and they're worse because they're not eating. And I'd rather them eat, even if it's bad for them, than not eat at all. So when you take a food, and you have like, this is your healthy meal, and I know it's healthy, and they don't want to eat, my approach is, well, next scheduled meal or snack time, we can try again. And there's no emotion in it. And you try again at the next scheduled meal and snack time. It doesn't mean that they get down from the table and 10 minutes later, you're giving them a banana to hold them over. There's none of that. And I also would really caution parents not to fill their kids up on milk. That can be just really a self-sabotage. Plus, most kids on the spectrum need to be casein free because of the because there's actually opioid peptides in casein that can look like morphine in the brain, and kids can actually be addicted to milk. So being dairy free is a big thing for kids on the spectrum. But then there's the gentle approach. They only will eat 4 foods, so then you replace one of those foods, and you do that for 30 days, and then you replace 2 foods, and you do that for 30 days, and you just kind of, the gentle approach. Some parents feel more comfortable with that. It's kind of like sleep training, because parents it's the cry it out or no cry it out solution. They need options, right? Mine is, I let my babies cry it out, and within 2 days they were sleep trained at 4 months. Both of them. And, there's others that are, they're like, well, they're still waking up with them until they're 2, and maybe even beyond. So with kids, with food, it's the parents, because I always remind my families, you're not responsible for what your child eats, because you cannot chew it for them. You can't swallow it for them. You can't assimilate it, digest it, and excrete it for them. But you are responsible for what you provide them to eat. Mm-hmm. So they have to take that responsibility coming in. And when you decide to change, your child will change whether they're autistic or not. They will catch up. In all my years of doing this, I've had one child that's gone more than a day without eating. Just one. Wow. Out of thousands of patients. So.
Wow. Well, that's good. I mean, that's good for parents to hear, because sometimes it can feel like not only a power struggle, but yes, a failure. I've not fed my child. I'm a total failure. So it's keeping that end in mind and figuring out something that works with the parent and child personality. Do you have any favorite foods that kids on the spectrum, or maybe this applies to everyone, should really be incorporating in our diet in an intentional way?
Oh gosh. I mean, I love it. Dr. Mark Hyman, who's one of the founders of functional medicine, he said, the majority of our diet should be carbohydrates. And then I took a pause, like, And then he says, carbohydrates from vegetables, that's what we should be eating most of, is vegetables. I mean, whether you are, growing a garden in your backyard, or cooking with food, or, just exposing your child to more colors and phytonutrients within vegetables. I mean, most everyone can really deal with putting more vegetables into the diet. The Cooper Clinic in Dallas says, Dr. Cooper, who he is the one that termed the word aerobics for aerobic exercise. 20 years ago, I became a fitness instructor, and he said, I listened to a lecture from it, and he says, 5 is fine, but 9 is divine. And he was talking about servings of vegetables in a day. And that stands true to today. We need more vegetables. So not the starchy white potatoes, but, the carrots and beets and greens, and, just keep trying. Get out of your normal, because most people, I make X, Y, and Z throughout the week, and we don't really stray from it. So, I think diversity is really important, but carbohydrates in the form of vegetables is what more kids need.
So interesting, and a good encouragement, a little nudge for all of us to think about how many vegetables we're serving in a day. If we don't serve it, they can't eat it. So of course, at Kids Cook Real Food, we'd say, let's get them cutting it up. Let's get them invested in those vegetables and excited about even just serving them to the family if they won't eat them yet, right? Yet.
Yeah,
Super
that's
important
awesome.
word.
That's
Super important.
awesome. Yeah.
Yeah. So, Dr. Gutierrez, I love to end with a message of hope for parents. And I do feel, though, that this whole interview has been a lot of hope for parents, especially those who just feel like there's so much weight and pressure on their shoulders, struggling with the different tendencies that kids with autism have. So thank you for that. And I know it's particularly important because of that burden, right? We talk about burdens, but there's such a mental burden, I think, for parents of kids on the spectrum. So what do you most want parents and loved ones and all of us to know about the potential for healing and growth when suffering with things on the autism spectrum?
Well, I think that it's important for parents just not to take the purely allopathic paradigm of care, which is, right now it's applied behavioral analysis, or ABA, which I think is an important therapy for a child on the spectrum, and I fully support it. But the only other thing that we really have to offer is medications like risperidol and antipsychotic medications, which, medications can be helpful for managing symptoms. But what we should be focusing on is there a source for their symptoms? Because if you can identify and eradicate the source, the symptoms go away. So, that's very, very important. I think we should just take a step back and say, is this a behavioral diagnosis, or is there a physiological underpinning for this diagnosis that needs some careful attention to? And the truth is, absolutely, you see, it's not just me in my book, which I wrote with my practice partner, Jana Rosso. It's not just our book. It is the Medical Academy of Pediatric Special Needs, the Institute of Functional Medicine, the Cleveland Clinic. I mean, there are practitioners around the world that are looking at autism as a physiological underpinning. So that's hopeful, because you can do something about that, right? There's power in that. There's definitely power to change in that. So
very much so. Very much a message of hope and empowerment. And I love that we get to leave parents with this. So thank you very much for being here. And the book is titled, I got to get this right, The Parent's Roadmap to Autism, A Functional Approach. And so just imagine when you pick up that book, get your local library to stock it, grab it on Amazon, whatever. We will make sure we link to it wherever we share this video. But just imagine yourself opening up a roadmap to become, your child's own detective and figure out those root causes of what's going on in their bodies that's affecting their lives and your lives so much. What a beautiful, beautiful gift, again, to these parents. So thank you for sharing with us today. And thank you for that book to get all these, this positive education out there.
Awesome. Well, thanks for having me on today. I appreciate it. And keep up the good work, helping families get more carbohydrates via vegetables in their lives.
You bet. We get the knives and the vegetables in the kids' hands. That doesn't always come across right, but that's what we do. So awesome. Again, thank you. And the next episode of the Healthy Parenting Connector, as always, will connect parents who want to raise healthy kids with the experts who have the information they need. And I'll see you next week.